Hello everyone, I'm Dr. Bhavya and today we are going to talk about ovarian cysts and cysts which affect the fertility of a woman. So ovarian cysts could be of two types. There's something called PCOS, that is polycystic ovarian syndrome, which layman refer to as cysts. So that in that what happens, there is hormonal disbalance in the body of a woman, and there's anovulation. That means her eggs are not increasing in size. There's no dominant follicle formed and there's no ovulation taking place. Thus there is infertility. Then there's another segment of cysts which are ovarian cysts proper. It could be simple cyst or complex ovarian cysts. So simple cysts are mostly the follicular cysts or corpus luteal cysts. So follicular cysts are those cysts. These are very simple cysts which are just fluid filled. What happens is the dominant follicle, which increases in size during the cycle, does not rupture and it continues to increase in size. So when it crosses the standard size of 3 centimeter, we call them follicular cysts. And then comes the corpus luteal cyst. In that, what happens after the rupture of the follicle, there's something called corpus luteal, which is a remnant and left behind. In that, the cyst forms, and then again that increases in size. It secretes progesterone hormone, and we prefer to suppress it before starting any stimulation cycle or when we are trying for fertility issues. And in case of simple cysts, follicular cysts especially, we do not have to worry much about the formation of dominant follicle and for pregnancy, because it does not really affect anything in the body, does not produce any kind of hormones. But yeah, because if the size is too big, then it might suppress the other follicles to grow around it. Then coming to complex cysts, there could be endometriomas or chocolate cyst, in which patients of endometriosis, the blood from the endometrium goes and gets collected in these, and they could be painful, and it could harm the other follicles around it to grow, and there could be hormonal disbalance too. Then there could be hemorrhagic cysts, which are not really complex cysts, but of course they have blood collected in them, and even they could grow in size, they could burst, and then they could cause acute abdominal pain and discomfort. So these are the basic simple and complex cysts. Then comes the malignant ovarian cyst, that goes into the segment of ovarian cancers, which we are not going to discuss over here. They are mostly those cysts which happen to women after 40-45 years of age, not in the reproductive age group. So it was all about the ovarian cyst. How do we categorize all kind of ovarian cysts, and we will discuss about the diagnosis and management in the next video. Thank you.